Hello, my name is Dolores Davis, and I'm trying to turn in my final assignment. I cannot get the Kahoot to work. I don't have something, and I can't get a hold of anyone at the campus. And the only thing I know to do is to upload a video. I even bought Microsoft Word for my desktop, but I have a Google Chromebook, and it will not work. So hopefully this will work. If not, please let me know, and I'll try to redo it. My PowerPoint starts out by the change, implementation, and the management plan. So in my executive summary of healthcare issues, a few that I've chosen is to collaborate with effective communication. They are vital for the efficient functioning of any clinical team. Without that, you have nothing. Medical mistakes are more likely to occur due to communication issues and poor teamwork skills, which I have seen happen if someone's intimidated to ask questions. Interpersonal miscommunication and conflict among professionals are some of the factors that can affect the teamwork and communication skills on clinical teams. Also, dissatisfaction and work conditions and nurse turnover are some of the factors that can affect the quality and life of the patients. So we have come to the quality of patient care is dependent on the effective teamwork among professionals. There are various medical issues that can be attributed to communication failures and lack of teamwork. Uncivil behavior among members of the team have been attributed to strained teamwork and interprofessional communication. This can result in decreased satisfaction with the care provided by the nurses, midwives, and obstetricians. In my case, it's something that you definitely do not want to go through. So we have gotten a proposed change. The program aims to enhance the communication and teamwork of skills in interdisciplinary teams. It is designed to improve the outcomes of our patients. The goal is to facilitate the development of a strategic behavior and team building. The program is going to facilitate and develop strategic behaviors and team building. Although the program and the team can improve its ability to listen, resolve conflicts, and be compassionate, which is super helpful because a lot of times, if you have no compassion, what do you have? I mean, you might be in the wrong field if you have no compassion and you're in the medical field, because you have to have compassion to even be in the medical field. I mean, you cannot be a doctor and not have compassion in some sense. I mean, I have seen nurses and doctors not have compassion, but it's very far and few between. So the changes continue. In addition to the team, we can improve its interpersonal communication skills and performance throughout the implementation of the team steps training, which is effective. This program is designed to enhance the teamwork and abilities of the interdisciplinary teams. The components of the teams are developed. The aim is to improve communications. The framework facilitates the development and behavior and coherent goals. Active listening, dedicated resolving conflicts, and flexibility are a few. These are all crucial benefits and contribute to fostering collaboration, teamwork, and respect among professionals, which is very important. So we're moving on to type and scope of the change. So the type of scope, our stakeholders in here are nurses, physicians, and of course therapists are all involved in treatment of patients. Simulation training uses an in-suit model to provide patients and participants with a comprehensive view of the management plan and change implementation. Emergency management in simulation scenarios involves group discussions. Going on with the type and scope of the change, the goal of the training is to provide participants with the necessary skills to manage their emergency situations. This program will be conducted in collaboration with various stakeholder groups as physicians, nurses, and therapists. These may include physicians, nurses, and therapists who will be involved in the treatment of the patients through stimulation activities. They will be able to improve their skills in the management of the PPH. The participants will also learn the team step, principles such as communication, leadership, and situation monitoring, which is super important. We're going to have change in the management team. The management team associated with complication requires the entire team to work together. This can be accomplished through the implementation of the STEPS training, which involves the participation of various medical professionals, such as physicians, nurses, therapists, all different kinds of professionals are going to need to all work together to make sure that we create the one goal at hand, which is to take care of the patients. The patients are the most important, and I think a lot of times people lose that side of that. They're too caught up in what they're doing, and it goes a little to the left, and we have to remember to bring ourselves back and remember why we're doing what we're doing. Even if we don't want to, we have to. For the patient at hand and their care, and as earlier I said, it's for their life. It's very important. Other individuals can help with the implementation of the training and include the chief of nursing, the hospital CEO, and they can also put we can intergrade different types of training systems and also computer aided training systems, which are very helpful for training, and they're available, when maybe we're not available to go to a meeting because we're on the floor working. We can go to them and watch that. Change in management team. The management team is associated with complications and requires the entire team to work together. So that is very important. Communication plan. The project manager, nurse manager, and nurse leader is a vital role of implementation of this intervention. Their responsibilities include communicating of the various aspects of the program, including resources and need for collaboration. It has an impact on all services, which is very important. Risk management plan, we're going to have in-suit training. We're going to expect burnout barriers for physicians and nurses. The heavy workload and resources can cause burnout. The heavy workload and lack of resources are what lead to the burnout. Although there are no known risks associated with the training, and it is expected to have various preventatives, successful enforcement of the program, and one of these includes lack of tools and effectiveness, and it involves training. So that is very important. I've listed out the resources, and I hope I've done a great job, and if I haven't, please let me know so that I can fix it. I do not want to fail your class. I just cannot get the computer to work, and I have got to upload this assignment. Thanks so much. Bye-bye.